Welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Mary Branch. She is a cardiologist and she wrote the Kevin MD article, Analyzing the Deficit of African Americans in Academic Medicine. Mary, welcome to the show.
Thank you for having me. Your blog has been extensively a cathartic experience for me throughout my medical training, and I'm just thankful to have this continued platform.
Well, thank you so much for sharing your voice. And we'll get into your article in a little bit, but first off, can you just share your story and journey to where you are today?
Sure. So I'm fourth generation African-American physician. So for several generations, we have practiced medicine and focused on the health of the African-American population. I'm from Youngstown, Ohio, and then I went off to prep school when I was younger, did a lot of my education in New England, went back to Case Western for medical school, and throughout my training now I'm in North Carolina. I'm a cardiology fellow, and my focus now is on patients with cancer. So I focus on the effects of chemotherapy and cancer therapies and radiation on the heart, and make sure that we're paying closer attention to these patients, following them before therapy, during, and afterwards when they're survivors, just to be their champion and ensure that their heart stays healthy throughout the entire process. So it's a very motivating mission, and I'm just thankful that I have the opportunity to do this.
So we've read about some of the challenges African Americans face during medical education or in medicine in general. What are some of the challenges that you faced during your own medical journey?
Sure. So I'm fortunate in that I am fourth generation African-American physician. So I knew internally that it was possible for me to pass medical school to be a physician. But sometimes, throughout my journey, it's been challenging to have those cheerleaders, to have those folks that say, of course you can do this. They give you the benefit of the doubt. You're still learning, but we know that you can do well. Unfortunately, even starting as early as sort of high school and college, there was some doubt when I didn't do well on a test or an exam that maybe this path wasn't for me. Am I sure I, really want to do this? And there wasn't always a lot of support around the fact that, of course, you can go into medical school. A lot of people, have a bad exam day or something like that, because it's more about the exam. It's practicing medicine is an art, and it's requires a lot more than being able to take a test. So I was fortunate in that I had a mother who was an infectious disease specialist. And so she was always someone that I could talk to lean on, and to just kind of to stay confident, to know that if this is something I was pursuing with the right mission and the right intention, that I could just continue with my journey. But again, I think a lot of it was just the lack of mentorship and the lack of sponsorship throughout medicine, where I had to really be my own champion, and my colleagues and in medical school also had to we just had to kind of huddle together and support one another. But unfortunately, we didn't always have the authority figures and leadership to be as supportive as we were of each other and internally. So I'm thankful that I had that, but I think there are a lot of folks that don't always have those people who are encouraging into this particular field. So that's what I hope to change.
Now you're nearing the end of your medical education journey. You're in your last few months of fellowship now. Now, for those starting out, particularly minorities, what kind of places do you advise them to look for mentorship and support?
I think that's an excellent question. It's all about the numbers. If a place talks about diversity and inclusion, that may just be kind of lip service. But if you really want to know if a place is going to support you, they are hiring faculty of color. They're hiring faculty who are African American. They are in different fields, in diversity and inclusion, but also maybe other fields, genetics, anything really. But I think having the numbers, hiring people, shows you that they support you, they support the people who look like you and who come from your culture, and know that you are perfectly capable and that they value you. So, if a program says we're trying to do diversity and inclusion, you don't know if this is something that they're just interested in for now, and maybe that'll change. But if they're hiring folks, if you have alumni that you can talk to extensively, that's what I would recommend, to really kind of reach out to the alumni. And again, you can find sponsors and mentors of many different races, but I think it's having the leadership believe in you specifically because they've worked with other people like you is very, very helpful.
And you talk more about that in your Kevin MD article. It's titled, Analyzing the Deficit of African Americans in Academic Medicine. Now, for those who didn't get a chance to read your article, can you just walk my audience through it and share the story of why you decided to write it?
Sure. I think through my journey, again, it's because I felt a little bit isolated and I really wanted to point out sort of the lack of African-American physicians in medicine, namely because that can impact patient care. So the article sort of talks about how there's a deficit of African-Americans in the medical system. And a lot of this takes intention to change. And this requires, again, recruiting faculty, this requiring nurturing students and providing sponsorship and mentorship, and it requires lots of intention. The importance of this is that, they've done studies, particularly in Oakland, and have found that, and when African-American patients have African-American physicians, there's a little bit more of that trust factor. I talk about that a little bit in the article as being an issue with hesitancy when you have an African-American patient and a non-African-American physician, is that we historically have been mistreated as patients in medicine. So if you think about the Tuskegee Project or Henrietta Lacks, these are cases of folks where they were, experimented on and not really cared for appropriately. So it's important at least to have a hospital where you have representation of African Americans, so patients can trust that they're going to be taken care of. So that was sort of the main point of the article, specifically in cardiology. So of all heart disease deaths, 23% are African-American, according to the CDC. African-Americans make up consistently about 13% of the population, but fewer than 3% of African-Americans are cardiologists. So this is a pretty striking difference in the statistics. And I think this is something that really needs to change, especially as the population is aging, as heart disease is progressing. I think a lot of it has to do with sort of the prevalence of hypertension and obesity. We really need to make sure that we have patients that are seeing, providers that they can trust. Certainly any race of providers can be trustworthy, but knowing that this is a hospital that supports people of color, I think can help the patient feel reassured that they're in a place where they feel safe.
You wrote this article 6 years ago, back in 2015. Has anything changed in the interval since then?
Yes, it has. I think, back then it wasn't talked about as much. It was something that I just sort of noticed but kept to myself. It wasn't something that I talked to with my research, PIs or anything like that. It's just something that I noticed. I would look around in a room and kind of, as the African-American, you always look around, who else looks like me? Nobody, wherever you go, nobody here, you're always counting and, you're one of three or something like that. That's just kind of important. It implies a lot of different things. So now, organizations like the American Heart Association have real intention. They realize, with COVID, that disparities were really striking in real time. They said, well, this really is an issue. We need to deal with the COVID before the COVID, which was health disparities and how this led to this divide. It didn't just happen. This is years and years of inequity. And so now I think there's a little bit more intention. There's more grant funding focused on health equity. There's more support. So thankfully, because I've been on this train for so long, I've gotten opportunities now to write an AHA statement about this issue and to be one of the leaders and to have a bigger platform to discuss this further. I also blog for the AHA, and they've been very supportive of anything that I have to say in terms of health equity and cardiology. So what's happened between now and then, I think there's a little bit more awareness globally, and there's a little bit more intention in how we can make changes. People are a lot more transparent. They don't just say bias, they say racism. I mean, people really want to get to the root cause of why we're having these issues. And so I'm thankful for that.
So we have a lot of leaders of academic facilities listening to this podcast. So you have a platform to talk to them. So tell us what more needs to be done from today that goes beyond lip service to diversity, equity, inclusion programs. What more needs to be done? Is it simply hiring more minorities, hiring more African-American physicians? Give us an example of some actionable things that you want to see done.
Right. So I think it's the whole pipeline. So to get to cardiology, you have to go to medical school, you have to do internal medicine residency, and then you have to do a cardiology fellowship. So sadly, a lot of times we lose folks along the way. So to get more sort of African Americans in medicine and internal medicine, you really have to start the nurturing early on. So, in medical school, just believing in folks, giving folks the benefit of the doubt, having sponsorship and mentorship, reaching out saying, hey, do you want to do this research project with me? That would be great. And it could be on anything. It doesn't have to be on diversity or equity. It could be on C. elegans, whatever you want to do research on, just, simply reaching out and being intentional that you want to include a certain amount of women in your lab, a certain amount of people of color in your lab. And that's what the American Heart Association is doing with their papers. They're being very intentional. I want this certain makeup of people. So if you start sort of in medical school and you start that nurturing and then have social events, really get to know people as people, and you find ways to relate with one another and realize that we're all just human beings. I think if you start early, if you're intentional, and then again, your hiring practices should also reflect what your intentions are. I think that is what I would like to articulate kind of globally to different hospitals, because in turn, you're going to have improvement in patient care. You're going to have new and novel ideas of how to deal with issues, health disparities, specifically in the community, because you have representatives from the community. We talk it because we live it. I mean, there's no other way to describe it. We live this. We live it every day. And so it's not just lip service. This is who we are. So certainly you would need somebody who's part of this community to try to change it. You need somebody who's part of it. That's the only way to really change it if you really want to change it.
We're talking to Mary Branch. She's a cardiologist, and she wrote the Kevin MD article, Analyzing the Deficit of African Americans in Academic Medicine. For those African American high school students and college students considering a career in medicine, but just aren't sure about medicine because of some of the issues that you discussed, what's
Sure.
your advice to them?
Yeah. So my advice to them is, if you get an opportunity to shadow with a physician and realize that you purely love this, that this is your mission, I would encourage you to really work on some of the imposter syndrome, things that we deal with internally. That's going to be your most important weapon, is to know internally that you're enough, internally that if folks when you pick up on bias, know that that's not reflective of you, that's reflective of their views of you. But if this is your mission, then you pursue your mission with, a great strategy, and you reach out to your network and you just find the right strategy for you. But folks will support you, some may not. That's just kind of the way it goes. I always say you have 2 haters and 1 supporter, usually the ratio of how it goes. But just know that this is just something that has to do with other people, nothing to do with you. So if this is your mission and you know that you are needed, because you are needed, then you just keep going and you reach out to folks like myself. I'm happy to share more emails of people like me who are supportive, have a supportive network for these folks, and they can always reach out to us for questions, for encouragement, to cheerlead them along.
And my final question, what are some of your take-home messages that you want to leave with the Kevin MD audience?
My take home is, I think, again, as we're coming into a new era where we recognize that diversity inclusion is important, to those that are in that position, I really want to encourage you to not just hold a title, but to really have the intention to make change, to ruffle feathers. And if that's truly your mission, then to do it fearlessly. If that's really what you want to do, then take the risk. And if that means that, you may lose that position, at least you did what you felt was right. And I think when you think about your end in mind, that's what's most important than just holding a title. So I think that we would all benefit. It's not a zero-sum game. And so we all benefit from diversity, and patients certainly benefit from diversity. The community benefits. And so I encourage us to be fearless and to move forward and do what's right, do the right thing.
Mary, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thank you.